Well, in the Coachella Valley, Desert AIDS Project says the rate of HIV infection is 400% greater than the national average. The organization, founded in the face of the AIDS crisis, continues to fight that statistic. In part 4 of this 5-part series, we look at how the Desert AIDS Project has expanded tenfold over the years. Bridgette PICOU is a nurse at Desert AIDS Project. Part of her job is to treat those diagnosed with HIV.
When I speak to a patient's experience and I tell them that you're going to be fine, it's coming from a place of, I know you're going to be fine.
PICOU can confidently say that because just a few years ago, she was in their shoes.
Allergies is what I thought it was. Ended up with a sore throat. Went in for the sore throat, and it went from that to diagnosis just kind of quickly.
PICOU was HIV positive.
Furthest thing from my mind, from my realm of possibility.
At the time, she was working in customer service and desperately needed help.
I didn't have insurance. I didn't make enough money to be able to afford insurance.
So Desert AIDS Project helped cover the astronomical cost of her HIV medication and much more.
I really was in a bad place. They helped pay my rent for me 1 month.
Well, Desert AIDS Project's goal is to stop the spread of HIV in the Coachella Valley. DAP provides so much more than HIV/AIDS care. The campus has everything from dental care, counseling, even affordable housing.
Today, 50% of our patient population lives with HIV. The other 50% does not live with HIV, but they are folks in the Coachella Valley who need holistic care in order to stay alive and eventually thrive.
Kid PARENTE is transgender non-binary and part of the 50% that goes to Desert AIDS Project for general care.
And the doctors at my previous clinic weren't helping me. And I was like, I need better health care. Help me. Like, I'm dying.
Dying at just 24 years young because of a procedure at a previous clinic gone wrong.
They got my sepsis under control. They got me to stop bleeding. They filled in the tunneling. Like, it was, I would have died if I didn't come here. So I'm incredibly grateful to DAP and specifically to Anthony VELASCO.
Anthony VELASCO is the co-chair of the Transgender Health Program.
It is very important to have this kind of program. A common theme that I always hear is that they oftentimes experience discrimination, harassment in places where they seek care.
Desert AIDS Project provides a wide variety of services for the trans community, but also anyone and everyone, regardless of money.
But we've learned that it's more than medical care that keeps people alive, particularly when the odds are stacked.
So in addition to HIV specialty care, DAP provides primary medical care, an in-house pharmacy, assistance with food, and the list goes on, all of which helps these faces of our community.
Well, without DAP, I probably wouldn't even be alive.
As for PICOU, DAP's resources and compassion not only helped her manage her HIV, but inspired her to go to nursing school. Regardless of what someone is going through, she hopes to leave her patients feeling positive.
I feel like I'm a stronger person. I feel like I'm more empathetic. I feel like I'm more determined, and I feel like I appreciate the little things more, which are all of the positive things that can come out of HIV if you let it.
In addition to all those resources, Desert AIDS Project's main goal is to stop the spread of HIV in the valley. DAP says if 90% of the Coachella Valley can get tested and know their status, and 90% of those who are HIV positive get on treatment, and 90% of those people show the medication is working, then we will be able to put an end to HIV in the Coachella Valley. But it all starts with you getting tested. Tomorrow night, we'll look at the legacy Steve Chase left behind. He's one of the founders of DAP. Coming up after the break, we sit down with CJ Toby, the community health manager of the Desert AIDS Project, to hear about some of the other resources it provides. Stay with us.